MaryAnn the Bobcat is just 4 years old and is one of our youngest bobcats. We'd like to put her and Max together, but they need to be spayed and neutered before we do that.
Yeah.
So today we are spaying MaryAnn the Bobcat. Both the video and the audio that you are about to see is really graphic, so if you don't have a strong stomach for this, you may not want to watch this video.
You're welcome. Hi, Angry Pants. I don't know if she's caught.
I bet she is.
On this. I don't remember which one I'm Her front claws right there on the edge. We might need to wait till she unhooks. Oh, yeah. Thank you. Lay down. You're gonna roll. Better yet, why don't you squish your stuff down near the poopy? That's nice. Sorry. Should work. It's 2 Q-tips taped together, so I think we can reach her now. She has no blink.
Why are you checking for blinking in your torture?
Make sure she's asleep before we pick her up.
Yep, so quickly. There's been instances in the past where vets have been bitten by tigers and alligators because they just wake up, bite a couple times, and then go back to sleep.
Oh, wow.
So we always make sure not to, well, not in that case, but not to step over the animals because you walk around them just to keep more safe when you're around them.
Because that's always like in the front of the animal, so that's why you've got the death grip on the scruff.
He's too far to stubble him. You know what we could do? Let's see. Let's put it in this room and see how long it stays. Oh, don't hear it. Hi, Munchkin. Oh, she's a little blinky now. Okay. We'll probably leave her just a little wakey since we're about to put her on gas. So as long as she's not since she has these, yeah, we're gonna make ours.
They're beautiful.
Yeah. You want to touch her claw, Lauren? Sharp. Oh, wow. You have to do it like that, and then you realize, wow, that'd rip your flesh right off really fast. And accurately, I'm sure. That's the impressive one. That one is huge. It would look like I'm bleeding with those atrocious red nails underneath. It makes it better. Okay. Those aren't bad. Your little that's weird. Gingival mass. Yay. You look like a baby. How old? 4. Yeah, she looks like a baby. You got a baby. So, I figured we could do Max there because, sorry, neutering's easy. Removing testicles is. And I know Justin does some of his the little tiny kitten space there, but
I didn't know if you wanted to do like some kind of a ultrasound or something on him because of his supposed rumored heart.
Right. It's cardio.
Whatever.
Blah blah blah. I
I mean, he's never been sedated for an exam,
Yeah.
so I don't know.
MaryAnn is being carried into surgery where she will be put on gas.
Videotaping. We think. Can you give me more info on him? We were gonna spin and put us this way. We need a Samantha, if you're helping, a temp and a booty cleaning. Sorry. Yes. But we did a fecal. On her when they came, right?
Aren't these the guys that all have all the nasty inside?
Hmm?
The Kansas cats, didn't they come with a ton of...
No, Skipper and Gilligan.
Skipper and Gilligan had hooks, rounds, and one of them had one more thing. We could retrieve the poo that's in the garbage can in that room. Or is it on the counter? The one you just collected? Do you know?
You declawed too?
No, ma'am. Oh, yay! She would like to be.
Can I have someone from the kennel come to the front, please?
So, but he was very excited, the Genome Project guy, about, we need blood too, Miss Kate, about knowing his story, because he said that there are a lot of the Bobcats up north are actually crossbreeding with the lynx.
And he looks at with that hardly any spotted coat.
Yeah, but so.
And that was something that was very common on the fur farms, was to hybridize between the lynx and the bobcats, because the lynx were so frail that they just couldn't survive a year in those horrid conditions. But people wanted the softer lynx fur.
Yeah, well, like Alex and all of those. Is it?
You fogging with your little finger?
Can you do that and then go back down? Will it? Because I think in the time it takes to put the catheter in, you could move on.
That tongue
who
is
do you
sticking
think
out
she
the
is?
side there.
Yes, CBC, Jen? CBC Mini's fine, because I can.
I have them right here,
Sam.
Okay,
I was gonna.
as well.
Sorry. Overgrowth, but that doesn't look like anything. Just gingival overgrowth. She didn't have much tartar.
Sam,
To
did you
look
grab the
at
tea
her
set and stuff?
Eyes. Pursuing a vet career.
Which is the first one in a while, as far as interns go.
That's what we were talking about the other day. Did you find out anything about like? And then there are different places, and this is just my husband's book online the other day. I'm like, haha, they do it to everybody. It doesn't matter. You can't make everybody happy.
The trolls are always the most vocal.
Kate to the front, please.
Yeah. And it.
Not that.
Yeah, he'll resolve that.
This one?
It was like the guy who, she's not wearing gloves while she neuters the tiger. They were nude colored gloves, and I went right back, they're nude colored gloves. I'm like, it's not worth it. By the time I write that, it's 3 days later. And
I like your hair better. Thank you.
What?
I didn't notice.
Carol is Jamie's mother. That's why we all think that's even funnier.
Sorry. Just watch that little clip thing that
Yeah. There, that's whenever we shave the tigers, I'm like, do I have clippers in my hand?
Oh, that's a lot better.
It was them.
Oh, so pretty. Here, they take all the way back to where my nail is. Oh wow. So it's like the first chunk of your fingernail. And sometimes they have weird things. We'll find like double claws growing out of areas.
So many of these cats that are bred for the pet breed are inbred, so they get really strange things.
This is my favorite part of the cat. It's the softest part.
Bobcat rescue. I'm going to have Bobcat blood and leopard blood today, but I don't know what your holiday schedule is like or shipping. So please give me a call or text me. It is 10:30 on Friday? Friday. If you want me to keep it in the fridge, that's fine, but remember Wednesday.
Are we saving this?
Or you want to?
Or I can do it when she's waking up, whatever you prefer. What would you
As
like
long
to
as
do
we
first?
don't forget. You have an extra plate bet.
No, I don't actually.
It is on your pressure machine. A little bit longer for the skin to heal because it's nice seared edges going together instead of nice easy edges that want to slip back together. So the laser has great benefits because it's also less painful. It's less painful. There's less bleeding. It's like a win-win, except it takes a little bit longer to heal. So I'm going to use the laser on the inside, but it's doing something funny. So if it doesn't, who cares? But I'm going to use a blade on the outside because then we can take her sutures out faster and put her back outside.
Okay.
Great plan.
But I think we will do the whole normal 2 layers of suture just in case we can put an e-collar on her. But I think if she takes her e-collar off, we'll be out of luck based on how grouchy she was just then. We sedated in the squeeze for obvious safety reasons. We always do what Jamie did, pokey from outside the squeeze, because it's really disappointing to pull them out of that safe place and have them still be awake and try to jam them back in, like perhaps we did with a cougar once. And it's really scary for all of us involved, and it's not safe. So we would rather them be asleep than not. Sadly, we'd rather them be a little more asleep than a little more awake. Like with a dog or a cat, if they're not completely asleep and we have to do things, we might be able to do a little. But with these guys, it's not worth the risk for them or for us. So we always poke to make sure they're okay. Jamie always holds their head. Did you talk about this?
Yeah.
Okay. And like check is watching their blink reflex is one way to tell if they're asleep or not. Their jaw tone when they're sleeping, the blink reflex, you kind of poke them in the corner of their eye, and if they blink, they're more awake. So all of those things we look at, whether they have muscle tone when you pull on their legs, all those things we kind of look at. Again, it usually starts pretty quickly with me listening to their heart versus looking like in their mouth. On a dog or a cat, I usually start at the front end and work my way back. But with them, we usually listen to their heart and lungs because one, we want to make sure they're doing okay under anesthesia, and then also, are you going to set up the laser just in case?
I'm trying to get it. It's not getting to the part of even registering that it's turning on.
Okay. Do you have access to somewhere I am? Or you did?
Yeah, just did it.
Okay. So, because when I listen to their heart, I can tell kind of how fast it's beating, how strong the pulses are and such, and I can determine if they need more sedation right away from that. And usually if they're kind of awake, by then Jamie's already saying, they're growling, he's moving, his head is moving, or something like that. And then we'll give them extra meds before we proceed. We don't really do anything until they're asleep enough that we feel like we can go on without them waking up on us, because that would be bad. So if sometimes you think, wow, they're kind of crazy over the top, we might be just a little, but we also haven't had anyone get hurt during a procedure like that, and we're proud of that, that we're so careful.
I don't think it's gonna work good.
The laser?
Yeah.
Okay.
I can see Dr. Slee's out of the room.
You know, I find amazing is when these cats are cut, how little they bleed.
I know. It's kind of, I mean, and when we do the laser, it's even less, but it is kind of surprising. We're always like, oh,
The laser.
They're like self-cauterizing.
ideas.
yeah, it's truly amazing. A lot of times.
The pressure's going low, Dr. Lee. Let me increase fluids.
Yes. And then you raise them to turn her down too. Is it 3? So, everybody gets looked at from head to toe. We spend a lot of time checking their mouth because a lot of them have dental disease, broken teeth that we have to evaluate or fix, things like that. We look for first. And 2, we're also deciding, are they going to need to be under anesthesia longer than what we thought we were going to do today? That helps us decide when we look in their mouth. And are looking for arthritis and grown-in toenails. We see that a lot because they don't do what they would normally do in the wild with their toes. They're not zipping things up and digging and doing all of that. So a lot of times we have to take care of that nails. While they're under.
Well, we're doing that now, but
He was running away.
Ovary. So ovaries are usually small and squishy and pink, not purple and pissed off.
she's not neat, is she?
Hard to tell.
Yeah.
she's always so
3-aught Maxon, please. Okay, so we've looked them all over. We draw blood because we want to know how their internal organs are doing, and this is our only chance to figure out what's going on with them, if anything. If they're sick, what have you, we can collect urine. We can do all of those things while they're asleep. Most of the things we cannot do while they're awake. So we take every opportunity we can to get information. We microchip them. We vaccinate them if we haven't already. All that stuff gets done while we're sleeping. When they're here and there, they're on heart, respiratory, and blood pressure monitors, so we can know how they're doing. Like Kate told me just a minute ago, her blood pressure was going down. So the two things that she's done already to help combat that are to turn up her fluids, because that'll bring more volume to her blood and allow her pressure to come up better. And she also turned down her gas. Gas anesthesia causes your blood pressure to go down, so that could just be one of the reasons that she's reacting well to the gas. We already reversed some of the medication that we use to sedate her, not all of it. So we can reverse that, and that helps her blood pressure come up too. And that takes about 10 minutes to kick in, so we might see a reaction from that too, but we can also see a reaction where she starts to wake up a little bit. So that's what Kate and I were talking about when we started things to watch for, to make sure she's not getting too light. Because you have to be really asleep for me to have your stomach, your abdomen open and me cutting out your girl parts. We don't like it when you try to wake up when that happens. Have any of the kittens done that when you've been doing them at the hospital?
No, but during Spayed Day.
Yeah, Spayed
There's
Day is
so
like an
many.
adventure, and oh my god.
And it's like they have them lined up like you don't know how long it's been sedated really. And
Yeah, and they're just all in a pile.
And
Not
it's
a pile,
It's
but
a lot of volunteers, so you're like, can you get this? I don't know what it is.
yeah. And when they wake up, when they're under anesthesia, they do this fun sit-up, and their whole body goes, "Rah!" And you're like, ah! And you just throw yourself down on them to keep your surgical site clear and keep them from getting bad things in their surgery site, and yeah. So, that's why here they're under gas anesthesia, so we have lots of control over how sleepy they are with that machine right there. It allows us to titrate how much gas she's getting over time, what concentrations of oxygen she's getting and what concentration of gas, so we can kind of keep her sleepier doing that. Kate, I haven't cut without the laser in so long.
I know, I'm
What will I do if there's blood?
Don't be. Don't do that.
She's like, I'm gonna cuddle with you and fall asleep in your lap, right?
My incision was way bigger than it needed to be. Yes, that's 2.
So we're thinking maybe
2
bilateral cysts?
angry uteruses. Yeah, well, maybe she was.
Maybe that's why she's so
Send
nice.
them. I don't even have a normal uterus picture to show you. But they're usually kind of pink and soft and fleshy looking, not purple, brown, and in our best medical lingo, we would call that angry looking. And all the little white patches, not usually there.
What
Are
it
you
is?
tugging on her?
Yeah, I'm tugging good.
Okay.
Is she?
Her heart rate's going up a little bit, not a lot, but.
Good.
I can't get this to go past the loading point. We calibrated it this morning.
Some-
I'm running out of time.
Exactly.
Like when the game, the music starts getting faster.
Yeah. The good news about a machine like that is you can tell it's getting faster. That's her heart rate.
Yeah, that's
Yeah.
why I
So
like
without
it.
even looking up, I can listen and tell. And when Kate's like, "Oh, I'm turning her up to 4.5," I'm like, "Yeah, that's her heart. She's more awake."
Is
'cause
this
she's
sterile?
pushing her guts
Or have you
up.
used
No,
it
no,
at all?
No,
we
we-
didn't even set it up.
Alright, you can try. It seems okay right now. Okay, do you know about these
Do you feel relaxing?
Mhm.
That's 5 good breaths.
So does that force
So-
more of the oxygen?
Gas.
More of the
So
gas?
we can turn the gas up and then give her breaths that give her more of the gas that has more concentrated gas in it, more of the oxygen that has more concentrated
Would you
gas
like the
in it.
laser?
We did all that, and we found out she's pretty healthy. We thought from the outside. We drew blood, which should be run now. On a normal dog or cat that's under anesthesia here, we run the blood first, and we want to make sure there's nothing wrong before we do anesthesia, but they're still awake, running around, doing their thing. With her and any of the cats from Big Cat, we don't really have that. Well, we can wait on blood work, and sometimes we do, but we knew today that this was our plan anyway, so if we would have sat around waiting for blood work, we might have waited 20 minutes to do the procedure that we were going to do anyway, so we just pressed on. But normally we would evaluate the blood work and change our anesthetic protocol, perhaps, based on any results if things were abnormal. If there are abnormal things, we'll deal with it, in this case, after the fact, which isn't what we normally do, but nothing we do this way is normal. So, when it comes time to spay an animal, you make an incision along what's called their midline, which is the center of their body, mysteriously named. There is an area where your muscle comes together and it becomes a fascial plane, which means instead of being muscle, it's kind of like, you know that white weird tissue on chicken that looks kind of like it would be, how would you describe linea alba? How would you describe that tissue in layman's terms?
Then flush.
Yeah, well,
muscular,
it's
like
strong
elasticy.
though. Yeah.
Yeah, I would say the outside of a chicken. What you peel off if you don't want the chicken after you cook it.
It's kind of, I can just show you. Yeah, it's kind of like, now I'm just being a freak. It's not muscle and it's not tissue that bleeds. It's kind of just a tendon sheath. Does that make sense? I think of what people would know, like without medical background, that you can cut through without having them bleed and it doesn't hurt. If you cut through the muscle, that hurts. So the two things we do on a spay that actually are more painful are when we pull on their uterus, which is what Kate was asking before, are you pulling? And when you cut through the skin. Those are the two most painful things in this surgery. Because they can feel it when you're pulling on their uterus, because you're pulling on, I'll show you after we're done.
Do they really feel pain, or are they feeling like the tugging?
Tugging. I think they
Sensation.
feel like the tugging, the pull. Because she also has pain medicine on board already. I am neurotic, so we always check for bleeding, because we don't have the opportunity to go back in if there's problem, and there's not. Because they do.
Everything but the white blood cell count ran.
What did it not do?
It just says.
It gives you an error.
Yeah, error.
What is it? But if you, oh.
Yeah.
You want to try it again?
I can
Or
try
you
it
just
again.
want to get more blood? Let's just get more blood.
Yeah, I gotta pull anyway. So I'll just pull.
ALP is a little.
So it didn't say everything's bad. It just didn't read at all, like the machine had a malfunction junction. Okay. All right. So back to spay. So a spay surgery is the female removing the female reproductive tract. In people, they don't remove your ovaries because you need the hormones that your ovaries produce to carry on life as a child-rearing adult, or at least not go into early menopause, which apparently is not fun.
God, let me tell you about that.
So, we remove everything though. We remove their ovaries and we remove the whole uterus, both horns of the uterus. Both horns would be where the babies would live if she had babies. And then we remove all the way down to the cervix. The cervix is important because that's kind of the base of your uterus, where if you were pregnant, your cervix would hold your baby in. If you've ever heard people say, ooh, my cervix was opening early and they like put wire in their cervix to keep the baby inside, that's what they're talking about. It's this little like sphincter that holds everything up in there. So we remove all the way down to that because dogs and cats can get this problem called pyometra. And pio is a Latin term meaning pus, and mitra is uterus, so pus-filled uterus. And it's deadly, potentially. Cats, they kind of do better with it, which is weird. But cats do better with everything. But dogs can actually die from it. And the interesting thing is they can have a pus-filled uterus and none of the pus come out of their body. So nobody knows like why this dog is really sick, but it's an intact dog and it's a few weeks after it went through heat and it just feels like crud. Well, the first thing we think of when you bring your dog in like that is pyometra. And the second thing we think of is who's going to do the surgery, because it needs to be done right away. You can't let that sit a couple days or all of the pus that's in their uterus makes their whole body sick. That tissue I'm talking about, if you want to look over my shoulder but don't come across this blue, come look quick. This is it. See how it's not, this is fat, this is skin, muscles down in here. It's thick, strong tissue. And that's what's going to hold her body wall back together. That's what's going to hold her guts inside since I got it open. Alright, so we're back to her uterus. We removed all of her uterus, her ovaries, her uterine horns, and her cervix so we could take everything out. That way, she won't get a pyometra, she won't get any of the estrogen-related cancers, like breast cancers. We see more commonly in intact dogs and cats. We see it a lot. We've seen a lot of them in the Cats at Big Cat, which is odd. Apparently, according to the Brian Davis guy, he was surprised that we'd seen a lot of that. But
I think it's because we're the only ones that really do these kinds of, these surgeries and this kind of medical care for our cats.
Yeah.
Everybody else
Everyone else
lets them die.
is like, oh, it's gonna be all mass. Well, it's gonna die. Yeah.
But that was part of the thinking in going ahead and doing this with her, not just so that she and Max could play with each other, but because we don't want her to be 20 years old and then facing this surgery.
Right. Yeah. And the worst part about cats, so dog has breast cancer, you remove that tumor and you remove that mammary gland. Any associated big lymph nodes, blah, blah, blah. A cat has breast cancer and the recommended treatment is to remove that entire mammary chain. So now she has an incision from right here where her first mammary starts to right here on both sides. Not fun. I've done it once. The cat did okay, but it was a miserable recovery. I mean, this poor cat was open stem to stern twice. And then it had chemo, I think, too. So for us, it's not worth it to even risk it. So when we do the surgery, we'll pull out the uterus, everything else, and then when we close them, we close everything in these cats in 3 layers. And the reason we kind of close them up real carefully is if she were to get her e-collar off and eat out her incisions, one, her intestines could fall out and then she could get sick and die. She could eat them. It's just bad. So we're like overprotective. So when we do the surgery on regular cats, I do a 2-layer closure. We close this thick layer and then we close the layer below the skin and they do great. I even had it was like Spayed at school cat, wild crazy cat that the lady brought in, and the next afternoon she let it out when she got home and it jumped up into the tree and jumped out of the tree and it was fine.
Do these sutures that are inside dissolve?
Yeah, so there's 2 different types of sutures that we're using. The inside sutures are dissolvable, and I'm going to put a layer of suture on her abdominal wall in that nice thick tissue we were talking about. It's called linea alba, and the reason they call it is it's the white line, and in Latin terms, linea is line, alba, white. Science is so easy. But then we're going to do a layer in this fatty business to cover that up. And then we're going to do 2 layers in her skin because bobcats are rotten.
Just the one, yeah, that's on something else as well.
No, GC, and that's fine. We'll close the second layer, then we'll close her skin and go on about our merry way. But we still need blood.
Got it.
So I think what they feel is pressure. So when we're pulling on their uterus, let's see, try to think how to backpedal. So if we were to do this surgery and be able to like see everything and get a look at all of her organs and see the very bottom of her uterus, we would make a gigantic incision. But what we do instead is we make a smaller incision and we use that loop to slide down along their body wall, and then you turn it and scoop back, because at the base of your cervix, you do hand gestures. Your cervix comes up like this, cervix at the bottom, make your thumbs, the cervix and the uterine body together, together, and then the horns come up like that. Well, this part where your thumbs are is attached in your privates, and the other parts have a ligament that goes from the top of where the ovaries are down to your body wall next to your kidneys. So we go in and we scoop the middle of that V Kate had in her hands up, and then we pull the uterus chunk up into where we can see it, and then we put clamps on below it onto all of those little blood vessels, and then we cut beneath the uterus. So we have to pull on all of that to get it up because it wants to live back here next to their back. So we have to tug on those body parts, and they're attached down by her back. So we always note that pets kind of react a little bit when we do that, so we think there is some sensation of us tugging, and maybe it is the pressure. But if we had to open her up gigantic enough to see it perfectly and go down and make a little incision way back here, we'd have to make our incision bigger. So veterinarians just got better at surgery and make smaller incisions, and you can get everything out a little tiny hole. In practice. So did you ever see in Spayed where like someone started bleeding or what have you? It doesn't happen as much in cats.
No, I mostly just had the weird waking up cat. They were using some kind of different.
They use
drug.
Tilazol, I think, and then they don't put them on gas, right?
Right.
Yeah.
It was kind of weird. The last time I went there, they had them on these like kind of like cutting boards, like plastic boards, and they're tied up. And so then they just have them on the shelf. So then when you get done with one, they get another cat off the shelf and bring it.
Oh my goodness.
That's how they carry
It's
them
like assembly
around.
line.
Yeah, for all the different parts, like getting shaved.
I don't know what's in the apple.
Wasn't he the one we built around his head while he was squeezed? That was the three of us and who? I think that was, yeah. Wasn't it the three of us that day? I don't remember.
I was probably filming it.
Yeah.
I don't really count as somebody that did it.
You were present.
Would you like me to walk down, or do you want to keep
Yeah.
it 3? Just
I would say your
Maybe.
walk might be to 2. Because you need blood and we need to get the E-collar on.
okay, so we'll sit at 2.
A garage door spring, and they put it on this mechanism where this coop, and then they had a full frozen salmon, a giant frozen salmon that they tied to it. I'm ready for the stapler in just a sec. Oh, thanks. And he would have to leap into the air to get it, but if he didn't grab a hold of it, the salmon would sling back up into the air, and then it would bob, so they had to chase it, and they said like the female would beat the snot out of it, and the male whatever, but they all had different reactions to it, and they said it was awesome.
Wow.
So, that was something. Okay. So, back to, we're paranoid.
Arcane lidocaines right here.
Great.
Your stapler.
So she has a layer of suture, nice and pretty down her belly. And in my world, they have to all be pretty and neat and whatever, because that's the only part of your surgery anyone sees. So nobody cares how pretty your knots are on the bottom, but if your incision looks like crapola, people are like, it's not together. Like if it's not like this, and it's like this, you can see the red skin underneath and it looks like it's opening up. So the point is, skin heals better like this, not like this. It doesn't heal well like that. So it has to be pretty and neat. But they make it ugly when you put staples in it. But we don't care because we don't want her to chew them out. We had Nyla leopard. We sutured her tail, and what, one day later, Carol?
Yeah.
Carol and I did it by ourselves, and she had ripped this giant hole in her tail, and she
You got staples?
And there's
Yeah,
not
but
much
we're
skin
good.
to work with.
And there's not much skin. And I was happy. It came together. It's a little tight. No, she didn't care. She was angry, and she chewed the whole darn thing out. So this is Marcaine and Lidocaine, which is a combination of 2 different local anesthetics. So our goal is that when she wakes up, she doesn't think, oh my God, someone cut me open, I'm going to chew them all out. This is numb. She just thinks she had a nice little nappy. That's our goal. Our goal now is more blood. Yeah. And I'm going to go get Beeper next for her.
Okay, goodbye.
So we're going to get her more pain medicine. And
She's got a great jug. I just don't use it enough to feel confident using it personally.
I don't ever use that one to, like, not drink well because of the anesthesia. We're gonna give her a bubble of fluids right here so she doesn't get dehydrated.
Let me know when you're ready.
Usually, but you never know with these guys. The IV is here to help support her blood pressure while she's under anesthesia. So the nice thing about having an IV in is that if she has low blood pressure, we can give her more fluids to bring her pressure up. We can adjust the gas. If we needed to, we can give her drugs directly into that port. She's going to have the fastest reaction to any medication we give her if it goes directly in her vein. If there was an emergency and we have an IV access, we can give her meds immediately that are going to go whoop, right into her heart, her brain, wherever it needs to go to help her do better. So in a domestic cat, we don't usually put an IV in. The things we do for them are kind of a lot more than we would do in a domestic animal, just because of safety reasons. You know, we can't have her wake up abruptly. We don't want anything to happen with her blood pressure or heart or anything, and then we can give her meds right away. All the other animals who are on anesthesia are on the same monitoring equipment, so all the pets here are on heart, respiratory, blood pressure monitors while they're under anesthesia. This one is annoying, but I like it. But it's better now. Let's say yes. This tube is connected. Yeah, about this way. Is connected to the anesthesia machine here. One, we don't want to breathe it because we don't want to get sleepy. Plus, it gives you headaches. Plus, it makes you miscarry.
Which was a lot of fun while Dr. Wynn was pregnant, that we couldn't let her anywhere near this stuff.
We just are careful. One of my friends wore one of those giant, like, hazmat masks. I'm like, seriously? But so this tube goes down her trachea, which is your windpipe, down to the base of the lungs here, so that the oxygen that has gas in it can go throughout her lungs. So as we're waking her up, then we have the option of squeezing, turning off the gas, only having oxygen flow, and giving her, have you pulled the gas out yet? No. Getting all of the gas out of the system that we can send in an exhaust tube out this way, and giving her just plain oxygen to help put only oxygen back in her lungs to make her wake up faster, which is great if we can hold her and cuddle her while she wakes up. But we usually pull this tube out a little faster than we would in a domestic animal because we don't have the ability to hold them. Like, usually we wrap them up in a burrito and the techs hold them until they wake up. So we can't do that so much with her. Her burrito has claws in it. But underneath here where she's been, it's nice and warm, and her body temperature is still nice and warm, which is good. Cats, we wait until they're swallowing because that means they have control over their windpipe.
E-collar. It's right there. Right there.
Licking your nose. You're getting wakey. Okay, now the bitey parts. Veterinarians like e-collars because pets don't chew out their incisions, but also mean ones. You have a buffer zone when they try to bite you. You're more comfortable with the other one. What other? The strings?
Somebody had this.
Yeah, very.
I don't know who.
With the eyes up.
Okay, how are you
Yeah.
with that? still on, not tight?
No, I mean, I'm not gonna try to pull it.
Just shut up and put her in the cage face. that hand clenchy part is the just let her in. She's fine.
She's moving.
Oh, Christy, Turney. He got a little red spot where we put the other injection in. Hate that. Hate that. Okay. And we like their face though, y'all. Or do you have to, I don't know if now that the machine on. I do not need that uterus at all, which would be nicer. Here, let me.
Do you need help, Lynn?
No, I think we're good. This way I can breathe fresh air. Ooh, thank you, Smithy. Aww, you're very sweet. Yeah, if you know anyone who needs a little kitchen. Oh, we have a black lab too that needs a home.
Big man. We do something different with
Keys?
Were you looking for me? Were you looking for me? It's a shame we don't have.
MaryAnn the Bobcat will spend the next 2 weeks in the cat hospital healing. Meanwhile, we will fix Max and build an enclosure to introduce the two of them to each other so that they have a shared new area that nobody feels territorial over, and hopefully they will be great buddies for the rest of their lives.
Yeah, actually, we'll probably set her up in that room, so just keep going right inside the door.